Are we live? Welcome to our first virtual and live Science Cafe. Dr. David Ingram, take it away.
Good afternoon. Welcome to the Science Cafe, sponsored by Sigma Xi, the Scientific Honor Society, and the Office of the Vice President of Research for Ohio University. I'm David Ingram, the Vice President of the local chapter of Sigma Xi and the Chair of the Department of Physics and Astronomy. This week's cafe will be given by Athens City-County Health Department. I'd just like to let you know about the next two science cafes. We've got one on Wednesday, September 16th. Professor Rob Brannan of Applied Health Sciences and Wellness will talk about our native pawpaws. He's a chef, so we should get some good information about what to do with our pawpaws. And after that, Professor Larry Whitmire of Biomedical Sciences will give us a tour of his lab, and we'll talk about dinosaurs. Science Cafe information can be found at ohio.edu/Science Cafe. Now, over to Roxanne.
All right, welcome back. Couple of ground rules. We're working with technology and we promise to do our best. We have everybody on the screens. Hopefully you can see and hear us well. I just wanted to introduce myself. I'm with the research division, and I have the pleasure of co-emceeing the Science Cafes. Today I will be the moderator asking the questions of the health department. Bryce, would you mind introducing yourself?
Yeah, hi everyone. My name is Bryce and I'm the contact tracer here at the health department, and I'm also an OU alum.
Jack?
Good afternoon, everybody. Jack Pepper. I'm the administrator here at the Athens City-County Health Department, and also am an OU alum.
Oh my gosh, I didn't know that. That's great. Dr. Gaskell?
Good afternoon. I'm Dr. James Gaskell. I'm the Athens City-County Health Commissioner, and unfortunately, I did not graduate from Ohio University. But I graduated.
It's never too late. Never too late. Also, with Dr. Gaskell, they are sharing facilities. You may see Ruth Dudding pop in. She is the head of communications for the Athens City-County Health Department. You can see her. She just popped in the back. We will see her later. So today we are going to have a conversation. It is based on some of the questions that you have submitted through the chat via Twitter for over the last week. We're also going to have questions from you that you are going to hopefully give us live. We want to hear from you, so please use the live function in YouTube. We're going to get to as many of these questions as we possibly can. And if, this is popular and it goes well, we even thought maybe we'd come back and do it again at a later date. So just want to say, all the information that we're going to be giving to you today are from a group of experts, and they are going to give you their honest scientific opinions. But everything is based on what we know today. The other thing that we have to say is that the information that we're giving is from us as individuals and doesn't necessarily reflect the policies and the procedures of Ohio University. So just be aware, okay? So here we go. We're gonna queue up our first video question that we received. Chris, if you could.
How effective are cloth masks protecting me and are protecting me from others?
Okay, so we're back live. The question had to do with the efficacy of cloth masks at protecting the person who's wearing them, and also how effective are they at protecting others. Dr. Gaskell, question to you.
I'm so happy you asked that question. That's one of the most important questions facing us in our society today. Actually, there's a wonderful article in the New Yorker written by Atul Gawande, May 13th, 2020, dealing with the pillars of prevention of disease, particularly coronavirus disease. And Dr. Gawande writes, by the way, Dr. Gawande is a Athens young man who grew up in Athens, went to medical school. He's an endocrinological surgeon at Boston, Massachusetts Hospital, and has written a couple books. Dr. Gwandi writes, there is increasing evidence that masks prevent disease. N95 masks are used by first responders and medical personnel. They prevent bacteria and viruses from being expelled into the environment by the wearer and prevent infectious agents from entering the respiratory system of the wearer. Properly worn, they are nearly 100% effective. They are the gold standard of masks. Surgical masks, which are the light blue masks, prevent delivery of virus into the environment 98% of the time, but protect the wearer only about 75% of the time. They are made of polypropylene fiber. When everyone wears surgical masks, infection is mitigated 98% of the time.
Wow.
Surgical masks can be washed once or twice, becoming damaged. Homemade masks, and that's what the question was about, are made of 2 or 3 ply cotton. They're attractive, colorful. They can be washed repeatedly, so they're very popular. Dr. Gwandi contends that they are 60% effective at preventing disease. When you review the literature, you discover that when you compare cotton masks to surgical masks, they are about equally effective at preventing the wearer from infecting people around them. So they're very effective at preventing somebody from expelling the virus into the environment. They're not as effective in protecting the individual wearing the cloth mask. There's very little data on that. But 3-ply cotton masks are effective, and actually there was a consortium of international scientists who suggested that if 60% of the population wore cloth masks that were 60% effective in blocking viral transmission, the epidemic could be stopped. That's a pretty encouraging statement. But cotton masks are somewhat effective, and I'm going to suggest that if that's available to you, that's what you should wear.
Okay, then I have a follow-up question for you, Dr. Gaskell. So, the university, I've got to make sure I turn it the right way, gave me this wonderful cloth mask, and I'm very proud. It says Ohio on it. How often do I need to wash it? And what is the best way to wash it, and why?
Soap and water. Soap and water will kill the virus if there happens to be virus on it. And I would say about every 2 days. I don't think you need to wash it actually every day. I think about every couple of days will work effectively.
Another question as a follow-up. If I wear it and then I take it off, let's just say that I'm in my office, is it a good idea for me to put it by the window in the sunlight? Does that help kill virus?
I don't think there's any data on that, but I can tell you that ultraviolet light does kill the virus. And people have been installing ultraviolet lights in their offices, etc., with the hope that indeed it would kill the virus. The CDC says this about that. They say that if you are in a small office, that an ultraviolet light in your office might be somewhat effective. But as you've noticed, when the CDC talks about mitigation of this pandemic, nowhere do they suggest that as one of their most important measures to take. They talk about social distancing, they talk about masking, they talk about avoiding crowds, but that's not on their list of things to do to prevent infection. But certainly ultraviolet light does kill the virus.
All right, well, thank you. At this point, I just want to remind everybody, continue to submit your questions via the live chat. I do have a question this time for Bryce. It was one of the first questions that we received. How does contacting or contact tracing work in Athens?
Yeah, so I am the contact tracer here. So if you're involved in that process, I'm the one that's going to call you. And basically what happens is when we get a confirmed case in Athens County, myself or a nurse here will go through a case investigation with that positive person, and then they identify lists of close contacts that they may have been around. So those are people that have been in less than 6 feet of distance for more than 15 minutes to the case. And then I follow up with those individuals, ask them how they're feeling, talk about the exposure, and make sure that they can quarantine in their home. And then we talk about, in addition to how they're feeling, making sure that they have everything they need to stay home for the duration of their quarantine, which would be their infectious period if they did have the virus.
So Bryce, some of the concerns that we have heard is that, if I talk to the contact tracer, then, other people are going to find out about me. Is that true, or is it confidential?
Not at all. It's totally confidential. So all of your information that we talk about on that phone call is protected under HIPAA. So just like you can't ask me about the case or anyone else, I cannot share any of that information that you give me with anybody else. Totally confidential.
Okay, and talk to me. Let's just say that I get a phone call and I have verified that I've been within 6 feet of somebody who now is tested positive. Talk to me about that quarantine. What is that going to be like for me?
Yeah, so quarantine is a 14-day period from the last date of contact. So the last time, say, that you were around that individual, we would ask that you quarantine in your home from that point. And say that was last Saturday, then we would go 14 days from then, so until the next Saturday. And just making sure that you're staying home during that time, not going out to grocery stores, restaurants, not having friends over, or going to visit anybody, just staying home and not being around others in close spaces for the duration of your quarantine.
If I am contacted by a contact tracer, am I going to be required to have a COVID test?
No, so that's not a requirement, and that's because testing is just a moment in time. Certainly, if somebody is feeling ill and they've spoken with their doctor and their doctor recommends that they seek out testing, we would support that, but it's not a requirement on our part.
Okay, thank you. Jack, I have a question. So we've talked about masks, and yeah, they're in great colors and shapes, and they become my new fashion accessory, I must admit it. But at some point, I would imagine that we are going to get to a point where we may consider rescinding the mandatory mask ordinance. What do you think the circumstances are that we might consider that?
Well, I think that that really is a great question, and we wrestle that question on a fairly routine basis at our office. The reality is that we certainly will need to see a sustained decline in disease, but ultimately, at this point, we would love to continue to see people using and practicing great, public health practices moving forward well into the future. But in terms of the actual mandate itself, that decision is ultimately left up to the governor and his team. And then also here in the city of Athens, the mayor and his team, which would be city council. Those were the folks that issued those orders. We of course supported those orders. Think that they've made an impact in the spread of disease. So to circle back and really answer your question, I think that we'll have to see a fairly significant sustained decline in the prevalence of disease before a serious consideration will be made to remove the masking mandate.
So as a follow-up, and I know you don't have a crystal ball, do you realistically think that we might need to have a vaccine before that actually happens?
Well, I certainly think that is a consideration. I do appreciate the nod to the crystal ball. I wish I did have a crystal ball and could forecast exactly where we're going to be. But I think that it is a fair assumption that until we have a vaccine, we should anticipate on the masking mandate to continue. I also think that it's fair to assume that once we have a vaccine, that it could be some time after the rollout of that vaccine before that mandate rollback is really considered. We all have to keep in mind that we're talking about 330 million people plus or minus here in the U.S. that are, we're hoping are going to consider the vaccination. That doesn't happen overnight. Our staff here at the health department is very resource strapped right now. We don't anticipate that once the vaccine shows up that COVID is going to stop overnight. So that'll be an additional task that we're going to have to manage in-house. So I could see the masking mandate continuing for some time into the future.
Dr. Gaskell, I have a follow-up question for you on that. Based on past vaccination rates, what percentage of the Athens population do you think realistically is going to be willing to have a vaccine?
Well, I'll answer that question in a minute, but I would like to talk a little bit about herd immunity and about what may be required in order to stop this pandemic. Measles is one of our most contagious diseases. An individual with measles will infect 18 other people. In order to prevent measles in society, you have to have about a 95% vaccination rate. Coronavirus, a single person with coronavirus will infect 2 or 3 people. So we don't really know what percentage of people will need to be immunized with coronavirus vaccine in order to provide herd immunity and prevent ongoing systemic disease. But my best guess is it would be somewhere around 90%, 85 or 90% in order to interrupt the pandemic. And so that's going to require us to immunize a large number of people in our population. And in response to your question, what your concern is, we discover that when we give influenza vaccine, we might only give, in a usual influenza season, we might only give about 40% of adults the vaccine. We do a little bit better with children, 55 or 60%. But influenza occurs every season. We've gotten used to influenza. People don't worry much about influenza. Mortality rate of influenza is 0.01%. The mortality rate for coronavirus is 5%. And as a result of this pandemic and the concerns and the daily news information regarding the mortality rate in the United States, I suspect that people are going to be very interested in getting the vaccine. So I think this is going to be different than influenza vaccine. That's my best guess. I think they'll be interested in getting the vaccine because of the mortality rate and because of the great concern that for many people, it's going to be an avenue to a normal life. And
I assume that right now,
what life is like. And I think a vaccine will provide that opportunity. And so I think people will sign up for the vaccine readily and quickly. And that's just.
Let me ask a very quick follow-up question, and I have a feeling I know the answer. Do you recommend that people get their flu shot this season?
I'm going to be first in line. Jeff Pepper talked about this the other day, and we both decided that we were going to sign up early on as soon as it becomes available. And
I actually got mine just last week at CVS, so just saying, yes, probably good thing. Okay, we have a question from Mary on YouTube. What data trackers on COVID-19 would you recommend as the most reputable? Can you explain the status of governmental, state, and national collections of such data in terms of their real-time accuracy? And I don't know if that might be a question for Jack or for Ruth.
Yeah, I can take it. Obviously we rely heavily on the Ohio Department of Health numbers, and so the coronavirus.ohio.gov website is a fairly reliable source of information. And then, of course, mimicking the coronavirus.gov website is our own website, which is Athens Public Health, athenspublichealth.org or .com. I think that there certainly has been some politicization of COVID-19, and I think that the question probably is speaking to some of the changes in the past couple weeks at the CDC, and information coming out of the CDC has certainly changed pretty significantly over the past week. They were reporting pretty routinely 11 metrics that were associated with each individual case. That number has now changed to 101 metrics or variables. So they've tenfold increased the amount of information that's available for each individual case. I do think that there is a little bit of a lag that's tied to the numbers coming out of the CDC. I do think that it is still a reputable source, but if you want the best information for the state of Ohio and locally, I think it's fair to assume that the information that you can get on the coronavirus.ohio.gov website and our website at athenspublichealth.org are the most reliable local sources that are out there.
Okay, thank you. I want to do just a plug too. The research division, in collaboration with the health department and also the city, has a Twitter account called Bobcat Discover. And if you've been following us, you've noticed that we've had a lot of COVID-related messages, and we've tried to make the graphics a lot of fun. And I just want to really give a shout out to the community. When I first started with messaging, we used to put flyers out. And we thought, if a few hundred people saw that flyer, we were doing well. And recently, with some of these graphics, the community's really embraced it. And we've had tens of thousands of impressions, views. And so I just wanted to thank everybody. When we named this Science Cafe and we said, college during COVID, one community, one mission, we meant it. Athens is a community, and I think that if we are going to get through this pandemic, it is going to be because we held together as a community, that we didn't always just value ourselves, that we valued others. So I just wanted to give a huge shout out to everybody for that. Our next question comes from Mason. He wants to know, how safe is it to run or exercise outdoors without a mask in a somewhat busy outdoor area?
Well, this is Dr. Gaskell. I'll try to answer that. Outdoor activities are safest, and so for those of us who go to restaurants, we try to eat outside. And any kind of outdoor activity is very safe. And certainly when you're running, you're not going to spend very much time with anybody. So it would seem to me that running outside would be a very safe activity. And it would be highly unlikely that you would acquire the disease that way unless you stop to talk to somebody along the path. Certainly that might be a little dangerous, but so long as you're moving, and you're outdoors, I would consider that one of the safest things that you could do.
Hey, Dr. Gaskell, would you agree that it is important for folks to choose their running partners carefully as well? You mentioned stopping to talk to somebody. I think it also is worth noting that that also means if you run consistently with somebody or exercise in general at all, whether it's riding a bicycle, whatever the case may be, that those same precautions of if you cannot do it distance 6 feet or greater, you should be wearing a mask, and then your activity increases in risk.
Well, that's certainly true. You might hope that your partner is somebody in your family that you're running with, and then you don't have to worry about that. But yeah, I think if you're running with somebody, that you need to distance yourself and mask if that is a circumstance. But I think if you distance yourself, you can, if you're outdoors and you're running, It's pretty hard to run with a mask, would seem, so you could do without that probably.
I think there's something that I've done, and you can tell me if I'm wrong. I'm ready to be smacked down if I've done this wrong. But so I have my husband and myself and my cat, and after a while, you know, things get a little lonely. So I have what I call my COVID buddy. It's one of my best friends. She has basically the same circumstances as I do, and we socially isolate, and we have the same kind of mask wearing practices, etc. And when we do activities and we walk and, you know, we meet, we basically figure that even though we're not family or not roommates, we're playing by the same rules and we're isolating the same way. And so we think that, you know, we're taking an extra precaution. I guess the question is, am I really, or am I just fooling myself?
Are you masking when you meet with her?
Yes, I am. And we meet outside.
Sounds pretty safe to me.
All right. I was afraid there that I might get my hands smacked. I'm glad. I think that there are times where, you know, you just need to move beyond your immediate family or your immediate friends. And here's a concern that I have. Running is great right now. Walking on the bike path is great. What happens when it's 30 degrees and sleeting outside? What do we do? Do you have some recommendations for some safe activities for us besides playing video games?
Sled riding, cross country skiing.
I also think it would be fair to add, you know, potentially swimming might be in there too somewhere. You know, a lot of that depends on how they spread you out in the aquatic center, but I imagine that would be a possibility as well.
Okay, thank you. I know that we're going to have to come up with some more ideas for people, because otherwise we're going to go crazy after a while once we all get cooped up.
Well,
but
you're talking a little bit about social activities and things that you can do.
Yeah.
I belong to a gourmet club, and we had a gourmet on our driveway recently. Social distancing, couples together. We had a couple tents we put up. The couples were 6 feet apart, and we had our gourmet that way, outdoors on the driveway, and it worked out pretty well, and I thought it was pretty safe.
That actually does sound good. I think I'm going to have to join a gourmet group. Okay, I have another question. Some data suggests that younger people have less severe symptoms. Does the data in Athens, Ohio support this claim?
Well, we have certainly a lot of data in Athens, Ohio. We've had 399 total cases. Of that number, 260 have been age 20 to 29. We've had one person hospitalized in that age range, which suggests that nobody has been other than that one person, has been very seriously ill. So indeed, the young people seem to do very well with the disease, and nationally that is the data too, that they are less likely to be hospitalized, less likely to have mortality. Other than in the very young children, sometimes they get something called a multisystemic inflammatory syndrome of children, and that is a problem that occurs a couple weeks after they've had coronavirus disease, and it involves their small vessels and multiple organs, and some of them can be quite ill. But aside from that, most of the young people do very well, and multisystemic inflammatory disease in children is quite rare, but we have seen probably 100 cases in the United States. Indeed, the young people don't get very sick, but that can be a problem. Sometimes they may not realize they even have the disease. They're so mildly ill, they may lose a sense of taste and smell, but nothing else. Don't have fever, don't have other symptoms, but most of them have learned that is a symptom of the disease and then go get tested. So the concern is, since the young people are not very ill, they are almost asymptomatic carriers. And so they don't realize they have the disease, and so they don't take the same precautions that they would take if they knew they had the disease. If they knew they had the disease, they would need to be isolated for 10 days. They don't know they have the disease, and they have really mild symptoms. They're out in society, and if they're not careful and aren't masking and aren't distancing, indeed, they could be a source of infection to other people.
Thank you.
Great.
Just a reminder, for more questions on the chat would be great. But right now we're going to queue up a video question, please, Chris.
Look at washing with soap and using hand sanitizer kill COVID differently. How do each of them work, and which one is more effective?
Okay, so we're back live. So the question is about hand sanitizers and washing with soap and how they might kill COVID differently. Can you talk a little bit about how they each work, and honestly, which one's better?
Yes, we do have some data on that, and we do know how these ways of cleaning your hands work. Soap kills by disrupting the fatty layer that surrounds the virus. And if that fatty layer on top of the virus is disrupted, the virus dies. Alcohol, which is what is contained in hand sanitizers have to have greater than 60% alcohol to be effective. Alcohol enters the virus and basically coagulates the proteins inside the virus and kills the virus that way. Now, I noticed in the questions there was also a question about 90% alcohol versus 70% alcohol. And 90% alcohol is not as effective as 70% alcohol, and that's because what 90% alcohol does is coagulates the surface of the virus, and then the virus has a coating then from the 90% alcohol, and the alcohol never enters the virus, and the virus is basically protected. The cover of the virus is protected because the 90% alcohol causes coagulation. 70% alcohol doesn't do that. 70% alcohol enters the virus and then coagulates the proteins in the virus and kills the virus. So 90% isn't so good. It doesn't get inside the virus.
So more is not always better, in other words.
I guess in this situation, that's true.
Okay. Hey, Bryce, I have a question for you.
Sure.
So you are doing contact tracing, and we know that sometimes people are reluctant to give information. They don't necessarily want to own up to the fact that they've been maybe to a party, maybe that they've been, not practicing all the rules that they know that they should. Tell me the science behind contact tracing and why it's so important to you and to the city and to the community that people do participate and disclose fully.
Yeah, so contact tracing is not new. It's not something that we just do for COVID. We do this for a variety of infectious diseases, and our nurses here do it every day. But really, contact tracing is a process we use in public health to identify people who have been in contact with an infected person and get them isolated or quarantined away from that person so that virus or disease doesn't spread. So when I'm doing my contact tracing or case investigations, it is really important for people to be honest about who they've been around so that people are not spreading something that they may not know that they have.
Thank you.
Yeah.
Okay.
Roxanne, this is Jack. Is it okay if I jump in real quick with a follow-up?
Absolutely. Yeah, go for it.
I do think that it's important to also note there's been a lot of question about is this a recommendation or is quarantine a requirement? And I think it's really important that we talk just for a minute about how we're managing that at the Athens City-County Health Department.
Please.
Just to be clear from the very beginning, it is absolutely a requirement of the law that you quarantine or isolate. So it's not an option. But the language that's used in the law can come across as harsh. And so a lot of times when we do these case investigations or we do these contact tracebacks, people are scared or they're nervous. And so we use language that isn't necessarily as harsh as that's in the law in an effort to try to build that relationship with whoever we're talking to on the other end of the line, because it tends to lead to a much better discussion. But we've gotten some questions, people have pushed a little bit, particularly our younger crowd. Is this a requirement or is this a recommendation? And I think it's very important that people understand that it is not a recommendation, that it is required, and that we do have some tools at our disposal, if need be, for folks who are not choosing to follow the quarantine or isolation guidelines. So I think that's a really important piece of the puzzle that there's been some confusion about.
Okay, I know one of my friends was contacted by one of the contact tracers, and it turned out that a determination was made that they were not within 6 feet for, the 15 minutes. And when I spoke to her, she was scared because she was like, oh my gosh, do I have to put my life on hold? But from what I heard you talking about, Bryce, it doesn't mean that you have to pack your bags and go home to your parents or have your husband or wife move out of the house, that there are coping mechanisms that you can give them to coexist and to get through those 14 days. Am I right?
You're right. It is possible to isolate or quarantine away from other people in your household. In some cases, maybe somebody has a lot of roommates and they may choose it's safer to go home and isolate just because there's more space. You may not be sharing a bathroom or close quarters with that person. But certainly, it's okay if people stay in their home that they've already paid rent for. I understand that. It's just really we want them to keep to their own room, not be sharing dishes or the same tools in the bathroom, and just keep to their own so that hopefully virus isn't spread.
Okay, so question. We did pop-up testing in Athens. And what were the demographics of the people who were tested? Age, gender, were they from Athens? Did they come in from out of town? And what did the results tell us?
Well, we had two pop-up clinics, one on August 7th and the other on August 14th. On August 7th, and these were drive-through clinics held at Athens High School. People stayed in their car, and they had a nasopharyngeal swab obtained for a PCR test, a polymerase chain reaction test, which is the gold standard of testing. And we got results within a couple of days. On August 7th, we saw 515 people. We had two positives. And one of those positives was an individual who had previously been infected and was getting a follow-up test. And his test happened to be positive again. And that's very common. And we might talk about that a little bit later. As a matter of fact, once you have a positive test for coronavirus as a result of a PCR test, that PCR test may be positive for the next 2 or 3 months. That doesn't mean you're contagious. Actually, we might as well address that issue right now. You're contagious for 10 days after you develop symptoms. You need to have no fever for 24 hours and have improving symptoms. And that clears you of infection and you're considered non-infected, even though with the PCR test, they might discover that you still have a positive nasopharyngeal test. The virus in your nasopharynx as a result of the test is considered non-replicatable. It doesn't reproduce itself, and so you're not contagious. But that doesn't have anything to do with the question. But I thought it was important information that you needed.
Important.
So anyway, we tested 515. We had two positives. The demographics of that group was that they were mostly young people. We had 280 from Athens, and that age group, most of the predominant number of people were from Athens. The age group was 20 to 29, 147, and then 30 to 39, 82, 50 to 59, 83, 60 to 69, 82. So the majority of people who came to that first pop-up testing were 20 to 29-year-old individuals. The second pop-up testing occurred on 8/14, and we saw 356 and had 3 positive tests. One was from Meigs County, one from Hocking, and only one person from Athens. And the age demographics for that were more equal. 0 to 19, 54, 20 to 29, 49, 30 to 39, 44, 40 to 49, 58. Pretty equally divided among all the age groups, except there were only 11 people in the 80-plus group. But the 70-79 were 38, 60, 69, 51. So it was pretty evenly divided among the groups. Genders, I don't have any information on genders, but most of the people were indeed from Athens who came, but there were individuals from the surrounding community also in small numbers. We learned from our 2 pop-up clinics that at the time we did the testing, we did not have much disease in Athens County. We expected to see some asymptomatic carriers, but it didn't see asymptomatic carriers really. But as you look at the data on asymptomatic carriers, you're more likely to see asymptomatic carriers in congregate living, in nursing homes, and in prisons. When they have a high incidence of disease, they certainly have many more asymptomatic carriers. So when you have widespread community carriage, if 20% of our populace was infected with the virus, we would see a number of asymptomatic carriers, people who are well and don't realize they have the disease. But they are very risky for society because they don't know they have the disease and they are not isolated, and yet they can be contagious and are contagious.
I think we also have to give credit to our community. When we asked them to wear masks, there was a huge difference. If you went uptown, you saw people with masks. And so I think that people definitely deserve a shout out for that. I have a question from YouTube. Actually, I have 2 questions, and they're related. Being physically distant, at-risk loved ones who we don't live with, it's been a hardship for them. How safe is it to hug someone if we're both wearing masks? So it sounds like they're not living together, and they might come together and, see each other. How bad is to do that one hug?
No kissing, no hugging. Risky.
No kissing, no hugging. Okay.
So
Now, Bryce,
elaborate.
Bryce might have a comment on that because she might interview some people. And Bryce, are you going to, if somebody hugs somebody else and one of them happens to have coronavirus disease, are they going to be considered a contact then and be quarantined?
Yeah, it would happen on a case-by-case basis, but there's certainly a higher risk for exposure there. So maybe think twice about that kiss or that hug.
Okay.
Yeah.
Go ahead, Jack.
I had a couple of things actually. One is that one thing that Bryce didn't mention in the beginning about contact tracing, which I think is important, is that there is an asterisk that's tied to the close contact definition of the CDC, which is that exactly what she said is verbatim what the definition is. But there also is sort of this strange little caveat that if the duration and exposure also should be considered. So just because you don't necessarily meet the 6 foot 15 minutes, the health commissioner or the medical professional that's making some of the decisions does have a little bit of leeway or flexibility, to quarantine if he or she feels that it's necessary. So that doesn't happen very often. But I actually think that it's relative, considering that we're at a university function. A classroom might be one of those scenarios, particularly in our K through 12 age groups, where those kids are around each other for lengthy periods of time over the course of a day, where they might be 6 foot spaced out. But if Johnny is ill and coughing and hacking all over everybody in the classroom, there is some possibility that quarantine could happen there.
Okay,
You know,
here's my related question. I think it's from a child, because the question is it okay if my mommy or daddy kisses me goodnight?
Yes. Yes. An unequivocal yes, because they're living together. I mean, you know, they share everything. You know, we were talking about contact tracing. You know, as far as contact tracing is concerned, and the CDC's opinion is that even if people are masked, if they are close to each other for a prolonged period of time, the masking is sort of almost ignored because they're not quite sure how people are wearing their masks. So as far as contact tracing is concerned, that is not considered a part of the discussion. It's very important to do, but as far as contact tracing is concerned, if you spend more than 15 minutes within 6 feet of somebody, it doesn't matter that you've been masked, because we don't know if you had your mask on properly, etc. So,
So here's a question related to contact tracing then for you. Do you recommend contact tracing apps provided by Apple or other developers? Because I can imagine somebody calls me and says, where were you in this time period and with whom were you interacting? So do you recommend these apps or no?
I'm actually not familiar with these apps. It might be something that I could look into. But generally speaking, you know, if you get a call from somebody that's not affiliated with the health department, or just saying that they are, and they're requesting information from you that seems a little fishy, like your bank account number or those sorts of things, it's not me. So just kind of know that if you have been in contact with somebody or think that you are ill and you've been around people, you can develop a list on your own, and just kind of keep that to yourself until somebody from your local health department calls and you go over that information.
That's a really good point. Okay, here's a question. Do you have thoughts on the best way to get through the semester while having students here? As a community member, I want students to be able to stay here and support them and our local community and economy. So, what are some of your thoughts about coping mechanisms specifically for students?
Dr. G, you got anything?
Well, you know, I think students need to do what the rest of society is doing: mask up all the time, social distance as much as possible, certainly avoid crowds. The larger number of people you are around, the more likely you are to get disease. And that's what the governor says, you know, crowds of more than 10 shouldn't occur. We shouldn't gather in parties of more than 10, because more than 10, you're more likely to get disease. So I think they need to, the students need to follow the rules.
But more than that, I understand, you know, that we are to follow the rules, absolutely. But just as a panel, I'm going to throw out a few things. There are a lot of outdoor activities that they can do, like go to the ridges, you know, go to Old Man's Cave, you know, all the hiking that can be done. We're really fortunate. I'll say one more. Have a picnic outside, socially distance, and have a picnic. What are some other ideas that you all might have?
So I've got one that's actually been really fun for me, and I'll just use it as a personal example. I've had the chance to actually bring my mother into the modern world with exactly what we're doing now, and you know, we've had a really good time doing the Zoom thing, and so while we haven't been able to socially connect in person, you know, we have been able to connect through Zoom, which has been really fun because she's not the most technically savvy person. I would say that that's probably fair for a lot of parents out there. And so that's been kind of fun for me to see the excitement and joy in her, and being successful at sort of something new. And then two, it's kind of a unique and interesting way to communicate. So I think that's a great way that you know, my wife has a weekly Zoom call with her best friends, And so they're connecting socially, which we know is so important in really new and unique ways. So I think that's another healthy outlet for not just the student population, but everybody to be able to sort of continue that social connectivity, but not necessarily be sitting in the same room together.
Okay, hey Ruth, welcome to the club. We haven't seen you yet. What are some of your ideas?
I just wanted to throw in the fact that, we all know that coming on campus is an exciting time, not just for the academics. And so I would just recommend maybe students get a tribe together, right? Pick out who your friends are that you're going to hang with. Get to know your roommate or your next door neighbor, and then do things together, really plan things together. I would also recommend, thinking about in every situation that you might be in, are you sharing cups? Is everybody touching the same thing? So, students on campus, just like everybody else, we have to think about things a little bit differently and innovate new ways to do the things that we really want to do in a safe way to protect each other. So that's my tip, my pro tip. Pick a tribe, get your friends, take care of each other, get close, just one or two people.
Sounds good. Okay, another question. Do you guys recommend the contact trace? Oh, excuse me, we already asked that one. Never mind. Next question. Can you explain the differences in the types of COVID-19 testing? There are several different tests out there. I'm guessing, Dr. Gaskell, you might want to talk about this.
Yes, I'm going to talk about testing. There are several tests available. The gold standard and the test that is usually performed is the PCR test. Now, the PCR test fulfills the requirements for a really good test, and the requirements are specificity. You want the test to clearly identify the organism that you're looking for, specificity, and sensitivity. You want it to identify that organism every time. So you want it to be a very sensitive test. And actually the PCR test fulfills those requirements, except it might be a little bit too sensitive because it will test people, they'll have a positive test for several months after they've had the disease. But PCR test is the gold standard for testing. Carey Mullis won a Nobel Prize. He's a chemist that won a Nobel Prize for discovering polymerase chain reaction testing. It's a DNA test, and it measures a strand of a DNA on the virus. So it's very specific, very sensitive. It's the most important test. It's a nasopharyngeal swab, and it becomes available anywhere from 24 to 7 days after you've done the test, depending upon the availability of testing in your area. The other test that's available is antigen testing. That measures a protein on the surface of the virus. It is associated with false negatives. The test is 93.8% sensitive. That means it's not as sensitive as a PCR, which is nearly 100% sensitive. So it's going to miss some. Some of the people that have disease, the antigen test will not recognize them. It will be negative. Rarely it's positive. The governor happened to have a positive antigen test, but follow-up PCR testing indicated that he did not have coronavirus disease. It's rarely falsely positive, but there are enough false negatives that it's certainly not as valuable as a PCR test. And then there's the antibody test. And antibodies, everybody's interested in antibody tests because they want to know if they've had the virus. Well, indeed, if you've had the virus, several weeks after you've had the virus, you will have antibodies. You'll have something called IgM antibodies, which are the first antibodies to appear after every viral illness that people have, and IgG antibodies. And the IgG antibodies are the long-term antibodies that stay with you for weeks on end. On the other hand, in the case of coronavirus, it's worth knowing that 8 weeks after recovery, a certain number of people have their antibodies fall to undetectable levels. Those people who are asymptomatic carriers or who have had mild disease, 40% of them will have undetectable antibodies 8 weeks after they've recovered. On the other hand, people have been very ill, hospitalized perhaps, or in an ICU, they have very high antibody levels. Only 13% of them will have undetectable antibodies 8 weeks after they've had the disease. So that means that if you're tested for coronavirus disease several months after your disease, you may not have antibodies. That doesn't mean that you've lost your immunity, because you may have something called T cells, which give you immunological memory. If you have T cells, and they're discovering now, there's some recent evidence that those individuals who have been infected with coronavirus have T cells. And T cells, in the laboratory at any rate, they've recovered T cells from people who are infected with coronavirus disease. And in the laboratory, the T cells recognize coronavirus again and will direct the plasma cells to produce antibodies. So if you have T cells after your coronavirus infection, you may have immunological memory, which means that when you're exposed again, you won't get disease. Now, we're not certain of that. That kind of work has been done in the laboratory, but that suggests that we may have immunological memory for this disease. Indeed, those people who have had coronavirus disease, there's only been 3 people who have had repeat infection. 3 people, and all the people that have been infected with coronavirus disease.
Only 3. Wow.
Now, I practiced pediatrics for a long time, and we would see people who had chickenpox get it again. Not very many.
I'm one of them.
Not very many. Maybe in my lifetime, I saw 4 or 5 people get it again. So most people have immunological memory, but all viral diseases have some failure, and some people may not have immunological memory. So
my parents loved me. First time, 5 years old, New Year's Eve. Second time, 12 years old, Christmas Day.
Well, it happens. It hardly ever happens with measles. Measles is such a potent antigen, it doesn't happen. It doesn't happen with chickenpox and some of the other ones.
Okay, well, at this point, I do need to say we have received some questions in the chat, and it's not that we're ignoring those questions. It's that they are more policy related to the university, and we just did not think that it was within our purview to talk about that, because the discussion today is really about the science behind the policy and the procedures related to COVID. So I'm going to ask you all a simple but difficult question. So the question is, with all the information that is out there, what is something that you would like to correct the record and just say, you know what, you might have heard this, but I need you to know this? Anybody willing to go first?
I'll go first. The disease is not a hoax. The disease is very real. The science is there. It is very quickly evolving, which we understand, and that can be very frustrating and difficult for the public to manage. It's difficult for us to manage as professionals. But this is a serious disease. The disease is real, and you need to listen to the public health professionals and the public health advice that's being shared and being used to prevent the spread of the disease.
Thank you.
I'd like to remind the public that there are asymptomatic carriers out there, and just because a person doesn't look ill and isn't coughing or sneezing or having any symptoms doesn't mean that they might not be somebody who could spread the disease. And that's why the pillars of mitigation of disease need to occur all the time. People need to mask all the time. People need to social distance all the time. And I think it's when they sort of get sloppy and don't pay attention, they're more likely to acquire disease, because there are asymptomatic people.
And I'll branch off what Jack and Dr. Gaskell were saying, but speaking with a lot of contacts and cases, sometimes there's the misconception that because you're not very ill, you may not be as infectious, but that is not true. Even if you are not experiencing very severe symptoms, or if you don't have symptoms at all, you're just as infectious as somebody who is ill in ICU.
And I'll just throw in really quickly that I know that there are a lot of young people maybe listening, and perhaps the perception is they don't get sick, or they don't get very sick. While that may be the case in sometimes, there are people that age that get very, very ill. And so we want to make sure that people understand anybody. There's really a very unpredictable, well, if you're high risk, then you reach a certain category, but people under that age, there really is, it's surprising how, and Dr. Gaskell's coaching me over here, but they can give it to older people. We want to make sure that that's true. But again, you can get very ill. We've seen young people hospitalized. And the last thing I want to say is that what is true today may be very different tomorrow. And as a Science Cafe, I think everybody needs to be aware that science changes very quickly, especially with this disease and the information that we're learning about the disease. So stay tuned, use reliable sources of information, keep updated with the health department. That's my last.
I am going to sneak in one last question because we have just a few moments. This person is living separately from their partner, who is a school teacher, and they are afraid that their partner is going to go back to in-class teaching and wants to know, realistically, do they need to stop seeing each other in person? Difficult question. Advice for Mary before we go?
Dr. Gaskell, I think that this falls into your category more than anybody else. I'm going to put you on the spot.
And you literally have 1 minute to answer it, and then we have to go.
I guess the conservative answer would be probably yes. It's young children are likely to get the disease, not be very symptomatic. Give it to this individual, and probably until we get a vaccine that. Now it has something to do with, you also might consider the age range that we're talking about. I mean, how old are the two people we're talking about? If they're, in their 20s, they might take the chance that they're probably not going to be real ill. If they're a little older than that, then they're more at risk for serious disease. But in general, there's some reasonable expectation that the teacher will get disease at some point in time. If the other individual's very young too, and they're both really young, then they might want to take a chance. But otherwise, risky business.
Well, I don't want to end on a downer. I think that what we're basically saying is this disease is real. The science is real, but it is evolving. And every individual needs to understand what risks that they're willing to take for themselves and for the people who are around them. And so we are going to end today's Science Cafe. Thank you so much to our audience. Thank you so much to the health department. Be well, be safe. See you at the next Science Cafe. Bye-bye.
Bye. Bye. Ruthie, do you want to say